Hello and welcome once again to my channel. In this video, we'll be looking at the effects of lifestyle on some non-communicable diseases, specifically smoking and diet. So the do now question is looking at trends in incidence of diabetes. So number of people diagnosed with diabetes and year. So how many people are looking at the trend of how the diagnosis of people with this condition increases over time. So describe the trend, and the trend is that it increases and it is also spiking. It's getting higher. So more people are becoming diabetics. Give an example of ways that the incidence of diabetes could be reduced. And generally, in this case, they're talking about type 2 diabetes. So in this case, diet, so improved diet, reduced carbohydrates, and regular exercise. So there you have the answer. So cases are increasing year on year and quite rapidly too. And to reduce the symptoms of it is to improve diet, so healthy diet, regular exercise. Now, so we're looking at the risk factors of certain non-communicable diseases developing. So a risk factor is something that increases the risk of a disease. Risk factors do not guarantee that someone will develop a disease. Risk factors may be an aspect of a person's lifestyle. Those who smoke are at a much higher risk of coronary heart disease, CHD, lung disease, and lung cancer. Risk factors may also be present in the environment of which you may be out of your control. So air pollution in densely populated cities is linked to many respiratory diseases like, for example, bronchitis and asthma. So here you have a summary of the risk factors, disease, and explanation. So smoking, lung disease, lung cancers, and coronary heart disease. So cigarettes contain thousands of chemicals, many of them carcinogens. Cigarettes also increase blood pressure. Drinking alcohol, risk factor, can cause liver disease and impaired brain function. Explanation: alcohol is broken down into toxic products in the liver. Alcohol can also damage nerves in the brain. Risk factor: obesity, disease, type 2 diabetes, and coronary heart disease. Explanation: obesity can make the body less sensitive to insulin, leading to type 2 diabetes. The body is then unable to control blood glucose. Diet and exercise effects on the cardiovascular system. A diet high in cholesterol and saturated fats has been strongly linked to coronary heart disease. And then here we have a graph. It's looking at, it says 7-country study, saturated fats and heart disease. And specifically, they look at the Mediterranean because their diet has it's got quite a bit of saturated fats in there, but then they don't tend to have the symptoms that people in other countries like the UK and the United States have. So the 7 countries study shaped the thinking of a generation of nutritionists. In this famous study, the diets in 15 cohorts of subjects in 7 countries were examined, and the risk for various diseases was estimated over time. Now, by looking at the graph, you answer these questions. So, what is the correlation between percentage of saturated fat and the deaths from coronary heart disease? Why might the Mediterranean diet be higher in saturated fat but cause less deaths from coronary heart disease? And 3, how might the consumption of red meat affect the number of deaths from coronary heart disease? So, number 1, what is the correlation? Well, as you increase or your diet increase in saturated fats, more people die as a result of coronary heart disease. So if you decrease the amount of saturated fats you consume, you also reduce or decrease the chance of dying of coronary heart disease. Why might Mediterranean diet be higher in saturated fat but cause less coronary heart disease? And it could be that in the Mediterranean, these people are more active. The weather is more conducive for them to be outdoors, being more active. As a result, they're able to use up these excess calories in respiration, and as a result, you would have less impact on their heart. And how might consumption of red meat affect the number of deaths from coronary heart disease? And as you can imagine, that would increase the deaths because red meat tends to be quite fatty or have a lot of saturated fat. So the 7 countries study shaped the thinking of generation of nutritionists. And in this famous study, the diet in 15 cohorts was studied. The most compelling finding was the positive correlation between dietary saturated fat and the risk of coronary heart disease. So the higher the intake of saturated fats, like I mentioned earlier, the higher the risk of heart disease. And then for the Mediterranean diet, it says the reason why the Mediterranean diet may have less deaths because they do alternative activities that enables them to respire quicker and remove excess stores of fat. Effects of smoking. So there is an overwhelmingly strong positive correlation between the number of cigarettes smoked by an individual each year and their mortality rate from coronary heart disease. Smoking is therefore a risk factor for coronary heart disease, and you can see on the graph as well. So facts about smoking and cardiovascular disease. 1 out of every 5 smoking-related deaths is caused by cardiovascular disease. Cigarette smoking produces a greater risk for coronary heart disease in people younger than age 50. Women older than age 35 are who smoke and take oral contraceptives are at risk or much greater risk of developing cardiovascular disease or stroke than women who do not smoke while taking oral contraceptives. Cigarette smokers are 2 to 4 times more likely to develop coronary heart disease or CHD than non-smokers. Cigarette smoking doubles a person's risk of a stroke. Cigarette smokers are more than 10 times as likely as non-smokers to develop peripheral vascular disease or PVD, and that refers to when the blood vessels become narrowed, so that limits the rate of blood flow around the body. Pregnancy. Smoking during pregnancy is risky for both mother and baby. Pregnant women who smoke are at increased risk of miscarriage, fetal death, detachment of the placenta, and premature labor. For the babies exposed to smoke during gestation, that is when the baby is still in the mother's womb, are at increased risk of sudden infant death syndrome, limb deformities, and low birth weight. Smoker's cough. How does cigarette smoke affect the airways? how does smoking affect the cardiovascular system? In posing health risks on the body's cardiovascular system, smoking causes immediate and long-term increase in blood pressure. It causes immediate and long-term increase in heart rate. It reduces cardio output, that is the amount of blood your heart pumps each beat, and blood flow in coronary arteries. Smoking reduces the amount of oxygen that reaches the body's tissues. It changes the properties of blood vessels and blood cells, allowing cholesterol and other fatty substances to build up. It damages blood vessels. Smoking doubles the risk of reduced blood flow to the brain. Smoking stimulates the blood clotting process. In addition, smoking has been associated with depression and psychological distress. So here it says choose the 3 worst effects of smoking on the cardiovascular system. I mean, if it affects the brain, if it affects your breathing system, if it affects your blood vessels and your blood cells, and if it can cause problems with your, with depression and psychological distress, I think all of these points are spot on, or reasons not to start smoking, or reasons to give up smoking. So here you have 2 graphs that you need to look at and interpret, then answer these questions. You have 6 questions in total. Smoking related diseases, the statistics. So this is for children, because sadly children do smoke. And which age group, which sex? Is it boys? Is it girls who are more likely to smoke? Is it boys? Is it girls who's more likely to pick up smoking first? And which age group is the more likely to smoke, etc. So what age group is more likely to regularly smoke? And it's 15-year-olds are the most likely to smoke regularly, and the percentage increase steadily peaking at 15 years. So 15-year-olds are the ones who steadily smoke. What do you notice about the pattern as children get older? As they get older, you find that more of them smoke. So there is a clear upward trend. The older the children, the more likely they are to smoke regularly. This suggests that smoking becomes more common as they progress through adolescence. Number 3, which gender is more likely to be smoking, and why could this be? Well, if you look at the graph, so girls are pink, and you can see that at age 13 it was girls, age 14 it was girls who were at the top, at age 15, well, all age groups, so children, but boys and girls, and then between 11 and 15 you have you're more likely to have girls smoking as well. So girls are the more likely to smoke than boys across most age groups. I plug my pen in. So girls are more likely to smoke than boys. This could be due to a number of reasons, but I have here social influences affecting girls, or differences in coping with stress, etc. Or sometimes they smoke because their friends are doing it. They want to fit in, they want to feel like adults, etc. Next one says, describe who is more likely to be smoking. So over the years, girls consistently had higher numbers of new smokers compared to boys. What do you notice about the pattern between the years and the number of boys or girls who started smoking? Well, there is a general decline between the number of children starting to smoke from 2001 to 2011. So you can see that the trend is down compared to where it started at. But you see that even though there was a general decline, girls continue to remain high compared to boys. And number 3, why could this be? Well, public health campaigns. So, for example, on cigarette packs, they have more graphical imagery showing what smoking can do to the lungs. And I think that might have been a deterrent. So public health campaign may have been more effective over time, and changing attitude towards smoking among the youth as well. So they're less tolerant of the odor that comes from cigarette smoke, as well as the understanding that passive smoking is not good. So they tend to stay clear of it as well. Now, you have another graph that you can have a look at, and it says reducing diseases. So smoking prevalence and lung cancer incidence by sex, so male and female in the UK or Great Britain, 1948 to 2010. And the trend is generally trending downwards, except of course for females it trends up, but the number is still relatively low compared to males. So, or the number per 100,000 is quite low. So it says, look at the cases of lung cancer compared to smoking prevalence. In 1980, what was the percentage of men that were smoking and women that were smoking? So for men, it's about 45%, and females or women was 35. So it's a 10% difference. In 1980, what was the rate per 100,000 of lung cancer for men and for women? So for men, the number of men with lung cancer per 100,000 was around 135, and for women it was around 40 per 100,000. Number 3, describe the pattern between the year of smoking prevalence or diagnosis and the percentage of adults who smoked cigarettes. And so I have here, there is a clear correlation between smoking prevalence and lung cancer. Men's smoking declined from the 1950s onwards, while women's smoking rose until the 1970s. And then you have lung cancer rate began to drop, that's for men, 20 years later, while for women it continued to rise, but it peaked around the 1970s, and then it plateaued there. And then the last one, why may there be differences between men and women smoking? Cultural norms, workplace habits, health awareness, women becoming aware of the impact of smoking on pregnancy, on the mental health, impact on their baby, whether they could have a miscarriage, or there could be learning disabilities that will arise as a result, or deformities, etc. So the awareness, I am sure, is a main reason why a lot of women would have stopped smoking. Okay, so smoking and health. So you have some questions here that you could do. You can pause the video and you can fill those in and then test yourself over here. So smoking damages our lungs. It makes the surface area of the alveoli smaller so that we cannot absorb as much oxygen. It also paralyzes the hairs in our windpipe, so dirt and tar build up in our lungs. And that's where you get smoker's cough, because the constant irritation in there. And so they cough with this loud grating sound that it would make you feel like you could really try and breathe for them. They struggle. Okay? So smoker's cough is as a result of these hairs paralyzing and the buildup of dirt and tar. Tar and other chemicals in cigarettes can give us cancer. To be fit and healthy, you should not smoke. And smoking is highly addictive due to the chemical nicotine. Next one is excessive alcohol consumption has been linked to liver disease such as cirrhosis. What is alcohol? Alcohol is a family of related substances, but most commonly referred to as ethanol, the active ingredient in alcoholic drinks. Alcohol is quickly absorbed into the bloodstream where it starts to have an effect on the central nervous system. The effects of alcohol vary from person to person with factors such as rate of consumption, so how often do you drink and how much do you drink each time, level of food slash water intake. So if you had something to eat before you consume alcohol compared to if you consume alcohol before eating, you have different outcome. Age and gender and body weight slash body fat. Long-term effects of alcohol. Like all drugs, alcohol is broken down or metabolized by the liver. Over time, heavy drinking damages liver cells, causing them to produce fibrous scar tissues, which blocks liver function. This is a disease called cirrhosis. Heavy drinkers are also at increased risk of cancer and damage to the brain, kidney, and immune system. And alcohol during pregnancy, from my perspective, it's a no-no, but from a medical practitioner's perspective, a pregnant mother can consume alcohol, but in small amounts, so not enough to affect their unborn baby. If she consumes too much alcohol, this could lead to miscarriage, premature birth, low birth weight. The baby could develop learning difficulties, behavioral problems, fetal alcohol syndrome. They could suffer from poor growth, facial abnormalities, learning and behavioral problems, etc. Drinking less heavily and often drinking heavily on single occasion may be associated with lesser forms of fetal alcohol syndrome. The risk is likely to be greater the more you drink. So what do you think are the three main concerns when drinking alcohol during pregnancy? What are the similarities and differences of drinking alcohol during pregnancy with smoking cigarettes during pregnancy? How could you encourage a woman or women not to drink alcohol during pregnancy? So here are the possible points that you could have to answer these questions. So number 2, you could have developmental harm to the baby. Alcohol can seriously affect brain and organ development. You can have increased risk of birth complications, example miscarriage and premature birth and low birth weight. And last, long-term effects after birth, example poor growth, facial abnormalities and behavioral problems. Number 2, similarities and differences between drinking alcohol and smoking. So similarities, both expose the baby to harmful substances through the placenta. Both increase risk of low birth weight, premature birth, and developmental issues. Differences, alcohol specifically affects the brain development and poor growth. Smoking is more associated with respiratory issues, sudden infant death, and placental problems. And number 3, how would you encourage women not to drink alcohol during pregnancy? Well, you can share facts with them about how alcohol affects the baby's development. Have an acknowledgement that pregnancy can be stressful and offer them alternatives. So it's about sitting them down and having the talk, I guess. And then sympathize how, or rather empathize how avoiding alcohol contributes to healthier pregnancy. And then you have another graph that you need to look at and interpret. So, standardized number of deaths from alcohol related liver disease for men and women. And in this case, you can see that uh, more men die from alcohol consumption. So, who's more likely to die from alcohol related liver disease? What may cause this change in the number of deaths over the years? That's my son. What factors must be considered to believe this data is accurate? So I've written all over the slide. So for number one, so I tried to keep them color coded. So who is more likely to die? So based on the graph, men are consistently more likely to die from alcohol-related liver disease than women throughout the years 2001 to 2008. Even after the numbers fluctuate, men maintain a higher standard of deaths. Number two, what may cause this change in the number of deaths over the years? Well, economic factors such as recession, the 2008 recession. This may have influenced drinking behaviors where people think their problem is greater than what they can cope, and so they will consume alcohol as a coping mechanism. Aging population or shift in population health, example, obesity. So older people, they tend to drink more. Um, People have become more sedentary. They sit down, play games, they drink their alcohol, they socialize, they're sitting down. So less outdoorsy type of activities. So consuming these excess alcohol, eating too much, etc., does have a knock-on effect, and then it impacts on their mental health. So rising mental health challenges might correlate with the increased alcohol use as well. When external factors, things out of your control, is bearing you down, some people will choose to smoke or drink in a bid to cope with their situation. What factors must be considered to believe this data is accurate? Well, you consider, was the data collected by the NHS, which is a reputable organization? Was there any health campaigns or policy changes that might have affected diagnosis or reporting? In this, oftentimes there are campaigns, so public campaigns from the government and the NHS, which look at, for example, the foods people eat. They color code them to help people to look and see on the labels if the food they're buying to consume, if it's healthy. They also have campaigns for healthy lifestyle, such as exercise, going to the gym, making it cheaper for some people to go to the gym. They will have campaigns for cigarettes where they will put pictures on the boxes to inform the public on the dangers of those. They will also have campaigns on the impact of binge drinking on the person's health, whether you are male or female. And then you can read through these different factors which can have an effect on a person's health. Alcohol, smoking, carcinogens, which are cancer causing, obesity, exercise, smoking and alcohol, saturated fats. Okay, so you can have a look at those, read them in your own time. Thank you for watching my channel. This video may be a little long, but I hope that you spend the time to watch it, make notes. It is very important for your GCSEs. Thanks again, and please don't forget to like and subscribe and also share. Thank you.